Thank you, everyone. Good morning, everyone. We're going to call to order for the Standing Committee on Homelessness, April 19th. It is 8:33, and I would like to ask for the roll call, please.
Let the record reflect that all members chair and vice chair of the standing committee are present.
Great. And please rise for the Pledge of Allegiance. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Great, thank you. To address the committee and speak on an item on the agenda, please fill out a speaker slip with the number of the item you wish to speak on and give it to the clerk staff. Speaker slips are available on the table just outside the council chambers. For members of the public that are participating through Zoom, you may raise your hand to indicate you would like to speak by clicking the raise hand feature on your screen or by pressing 9. We will announce when to raise your hand to indicate you would like to make a comment on the specific item being discussed. Speakers will have 3 minutes to address the standing committee. For the approval of our minutes, I would go to the city manager for March 21st.
That would be a motion on your part to approve the minutes if you are in agreement.
All right, we would vote to approve. I also would approve, so we approve the minutes. And then we get to move into discussion. Do we have any speakers at this time? Okay. So the first item on our agenda is to discuss housing and tenants' rights issues. I have a couple notes on that. I asked for this item to be on the agenda this morning. I believe I may have questions for you, Mr. Lung, if you'd like to join us at the front here. All right. So the purpose for me bringing this item on the agenda is because I've been working with city staff and having internal discussions about what I see are tenant issues in the city of Vista since July 2017, last year, if not earlier. And from those discussions, one of the biggest remarks that I received from staff was that fair housing issues are the highest number of calls that we get. From my conversations with staff, which were motivated and facilitated by conversations I was having with constituents and members of the community who would ask, what do I do if my landlord is raising my rent and it's all of a sudden I can't pay my rent because he raised it so much? Or what if my landlord, what if she doesn't fix the mold issue in my bathroom, right? I was starting to identify common instances of what may be considered violations of California code and also tenant rights. And these are instances I think the community has reported in different ways. Sometimes they have reported it to our city staff, maybe calling our Housing and Homelessness Services Division, but they also have reported it to people like code enforcement, to law enforcement. They've reached out to nonprofit organizations, and members of the community have also reported it to me. And as I started hearing about this, I met with city manager and city staff about what can we do to respond to people's complaints about their housing needs as it relates to their relationship as a tenant to their landlord in the protection of their tenants' rights, but also in the preservation of their housing. In addition to the complaints, the housing complaints related to health and safety codes and habitability requirements, I've also been made aware of harassment and retaliation from landlords who may or may not respond to the tenants' complaints And there are times where the tenants do not complain to their landlord. So that's a reality too. So there's all this information I'm receiving from tenants in our community. And what I've learned so far from city staff is that, and I wanted to have a public discussion just because, I can't just meet one-on-one with every single resident having this problem. I'd like to put the information out there. If you are experiencing a tenant issue, you can contact the City Housing and Homelessness Services Department because the council has approved a contract previously with CSA Fair Housing, and they can make a referral and delegate those activities to CSA Fair Housing. In addition to that, people might be referred to code enforcement because code enforcement works with the County Health and Human Services Department to ensure that people are in a habitable environment with their housing. Mr. Long, do I have all that information correct?
Yeah, that's correct. I would just add that we would suggest members of the public to call CSA directly with those tenant-landlord issues. Of course, those are disputes between two private parties. We wouldn't be able to help mediate that. And so they would need to speak directly with the tenant. And so we would encourage clients to call the CSA directly, for which the phone number is 619-444-5700. Again, that's 619-444-5700.
Okay. Is it, and I would have to make sure I'm updated on the contract as well, because they're kind of realization I was having about our CSA Fair Housing contract that can help us provide services that maybe we weren't providing before, want to make sure that we're fully utilizing all of our contracted services, right? We're not letting anything go to waste, that we are fully utilizing our services. It's really important for me to impress upon our city staff that if we are going to refer people, that we are following through on making sure that we make the greatest use of those services. And then I would also just ask if perhaps you can answer this, or city manager, city attorney, do we have it outlined in the contract if how referrals are conducted to CSA Fair Housing? Is it ambiguous or?
It would just be, again, the clients contacted them directly. We could certainly refer them. If they did call the city first, we would provide them with a phone number, but there's no limit to how many clients they could assist.
Okay, so if somebody calls the city of Vista, do we, and they say that they are experiencing a fair housing issue, what happens if they also have a habitability issue that we know that is a violation, a complaint that could be perhaps a violation of California Civil Code? Do we direct them then to code enforcement and work internally with the person?
I don't know that we've had that situation arise yet. There have been some instances, of course, where there are some issues with the building itself that the tenant is claiming the landlord is not addressing. We do still refer them to CSA. If there's an issue that if the city could address, I'm sure it would be referred back to us.
Okay. From speaking with the city attorney, some of the items that the city would address, in addition to referring to CSA Fair Housing for more expert support for fair housing issues, would be within code enforcement, because we operate a code enforcement here in Vista. And code enforcement has their own process to advance these complaints to the County of San Diego. Mr. City Attorney, at what point would this complaint no longer be the city's responsibility?
If it's not within the Vista Municipal Code or Development Code, code enforcement would have no authority to enforce or to investigate it. So at that point, we would turn it over to the relevant agency or entity to investigate.
So they would have no authority to enforce or investigate, but would we have a responsibility, having received this complaint from a member of the public to our city, to ensure that they are referred to the party that can enforce and investigate? Or what is our responsibility?
I mean, as the government entity, we would have basically just the general, government responsibility to refer it. We wouldn't have a legal per se responsibility, but we would definitely try to refer it.
Okay. And we don't have a policy outlined that we do those referrals.
Not that I'm aware of.
Okay. Your thoughts, ma'am?
I just wanted to give you a piece of information. The California Department of Fair Employment and Housing is the law enforcement agency charged with enforcing the state's fair housing statutes.
That's great. And I'm imagining, I wouldn't know exactly, but the county of San Diego, if they're the ones investigating, would they be working with that department?
I don't know if the county investigates on behalf of the state or if the state actually has. Maybe we could ask a representative from the State Department of Fair Employment and Housing to come and give us a presentation.
I think that's a great idea. We're having some great discussions in the standing committee. Let's also hear from this group as well. With that information being available to the public now, that if you're having a tenant issue, you can contact the city and they will provide information about CSA Fair Housing. I would love to have people call CSA Fair Housing directly. Sometimes people come to the city because it's the most comfortable place for them to seek resources because they see us as a beacon and a supportive organization that can help them in their time of need. But I also understand that we don't currently have programs or policies to specifically direct them one way or the other. So I'll be thinking about that. And I would also ask city manager, do we have currently a process of documenting the calls that come in to housing and homelessness services?
Yes, we track those just in terms of when they come in, what the call was about and what the referral was. I think we have a spreadsheet basically that we keep that information.
Okay. And what information is available, like their name, that they're a resident of Vista?
Mr. Lung.
Yep. So their name, contact information, the reason for their call. This also includes walk-ins as well.
Okay.
And the different resources that they're referred to from the call.
Okay.
Which could include, like the Deputy Mayor mentioned, referrals to code enforcement for certain issues that the city does have purview over, or referrals to the county or the state or any other agency.
Okay, great. Well, with that, I, have continued thoughts on this. I've been working on this for a while, and I want to understand what the city's scope is, right? I want to make sure we're utilizing all of our contracted services. I want to make sure that we're partnering with other agencies like the county or state departments. So I wanted to have a quick conversation about that as I'm having my own ongoing pursuits of improving this issue for the residents. Because last week I met with a group of about 15 residents, right? I'd been having individual conversations with people. And then a group of residents came to me and we met here at the city and they shared their complaints. They let me know what was going on.
How about we let our housing director research the relevant law enforcement and other state and county agencies that might have purview, and maybe you could suggest to the chair of the committee who you think would be relevant to come back and give a presentation in a future meeting about tenant rights and who tenants could reach out to if they're having issues.
I agree. Any other thoughts on this item?
No, good.
Alrighty.
Good question.
Let's move along to discussion 2, where we will overview the regional task force on the homelessness, and we'll see CEO Tamara Kohler, and you'll be here to provide a report. Thank you for being here.
Wherever you're comfortable.
Yeah.
Okay.
Yeah.
Good to see you. Thanks for being with us today.
Thank you.
Press that red button right in front of you.
Oh, there we go. Better.
Yes.
So I this week have been in DC at a hearing, up at the Sacramento yesterday on a budget hearing, and now here in Vista. You would think
Press that red button one more time.
how's that? Better?
Yeah, thank you.
All right.
You tapped it.
Hands free. Thank you. I'm Tamara Kohler. I'm the CEO of the Regional Task Force on Homelessness, as most of you know, Mayor and Deputy Mayor and City Manager. We're going to do a little bit about the continuum of care. sort of where it gets its authority and statute. Just to sort of dig in, I always start with what we believe. We are a nonprofit, so we are not in government, we're not city, we're not county, state, but we're federally authorized. But also as a nonprofit, every presentation I do, we have the slide. And I think it's important to level set why we do the work that we do. I firmly believe that homelessness is solvable. It is getting more and more intractable in the ways that we're struggling with it. But I do believe as communities who want to care for the folks who are experiencing homelessness, we know that that is primarily focused in housing for everyone. That folks are most successful in housing with the right level of supports. We firmly believe that housing is a basic, not only right, but need for folks. And that means all types of housing. Also, that homelessness is an experience. We're not labeling people. And I know as a community here in Vista, not only your elected leaders, but those that serve in the city, the care and concern of taking care of those citizens of Vista is why you're interested in addressing homelessness in an intentional way. I'm not going to share a lot about RTFH as a nonprofit. I'm actually going to talk a lot about our role as a continuum of care. And just want to level set how we are not only federally authorized, but how we assume that role here in the San Diego region. We have a 31-member board, and as a continuum of care board, it's a community impact board, so it's not an entity, but it's required under federal statute. So I have a 31-member board that has the responsibility to designate an organization as the lead organization or entity to fulfill all the roles and responsibilities of a continuum of care. So we actually have an MOU with that body that authorizes the Regional Task Force as a nonprofit, as an entity, to do all of the roles and responsibilities of a continuum of care. So I just wanted to give you kind of a level set of where that comes from.
You probably just said it, but what's the name of the organization? So RTFH has a contract with, what was the name of the organization with the 31 members?
It is with the continuum of care. So the continuum of care is a geographic distinction designated by HUD. There are nearly 400 of them across the nation. And in its role and responsibility, this geographic area has to have a board that's required to receive funding. That board, which is a community impact board, if you think about it, as we think about community impact, that has no ability to actually receive funding because it's got to be an entity that fiscally can do it and has all of the requirements. They designate or choose a lead organization. That's done through a vote. We have solidified that in a written MOU. So it's very clear how we speak for, represent, and what we do as the continuum of care lead agency.
Now, you mentioned geographic. So there are boundary lines of this geography?
Yeah.
And is Vista within the boundary lines of
Yes. Yep.
Okay.
And actually, just give a little bit of history, there was once in our region 2 continuums of care. There was one for the city and one for the county. And those merged a number of years ago. And so our footprint, our geographic responsibility is the exact same geographic boundaries of the county of San Diego. So we are responsible for the entire, all cities, townships, unincorporated, everything that falls within the county's geography. So this is a little bit about where the authorization in the statute for continuum of cares come from. It literally started in the early 2000s. In May of 2009, they formalized it. It comes out of the HEARTH Act. I don't think anybody ever calls it the Homeless Emergency Assistance and Rapid Transition, but that's what the HEARTH Act stands for. And it amended what was at the time the McKinney-Vento Homeless Assistance Act. All that did was take a couple of different HUD programs and put them all together and increase some of those resources. It's not a large funding source. It hasn't been for a number of years. But I wanted to make sure you know what is the legal statute behind it that creates a continuum of care. In 2012, under Federal Code of Regulations 24,578, it gives you the details of what are required of a continuum of care under the HEARTH Act. What's important is the work that the federal government has done in addressing homelessness still sits in an interim rule. So we sit under what is known as the continuum of care programs. in this work that was done, you can find it in the Federal Registry in 2012. It became effective in August of 2012. And it still is in different places where it is not finalized, and there are places and times where we can give input. So we work under an interim rule that gives us statute, authorization, and responsibility. Primarily, continuums of care were created to be planning bodies, which is interesting when you really think about it. It's why we have a regional plan as the continuum of care. It's a requirement not only that we think about everything that we're doing in our continua, but it is one of the primary roles and responsibilities of the continua. It was created to do planning. Also, as a response to addressing the needs of homelessness, that interim rule established not only the continuum of care, but it gave us these three main duties. So one, operating the continuum of care, that is holding board meetings, that's supporting and speaking to issues, being sort of the subject matter expert in federal funding, state funding, designated an HMIS for the continuum of care. So the homeless management information systems were started in 2000, really formalized in 2009, and really came into practice in about 2012. So when you think about that and changing and collecting data, it's been about 10 years of sort of leaning into that space, and then to plan for the continuum of care. So that are the primary roles of a continua. Under that are a whole bunch of different spaces and places and responsibilities. The state of California began adding to a continuum of care's responsibilities when it started the HEAP funding in 2018. Before that, states didn't invest with continuums of care and didn't have much input. So in San Diego region, RTFH being the lead organization, if you were to look us up federally, we are actually, it's listed as San Diego City and County Continuum of Care. These are the things that we do in our community, specifically to execute the roles and responsibilities of the continuum of care. And you guys all know these. The point in time count, that is a required activity for the federal government. We know that it's one night count. It is a minimum. It is a very blunt tool by which to collect data and information. Of course, administer the homeless information system, promote best practices, training, and standards for assistance. We're required to write standards of care, written standards. We operate the coordinated entry system, which was added to continuums of care in about the 2020s. We do and conduct policy advocacy and research around the data that we are stewards of. We fund homeless services. We are a collaborative applicant for the only competitive grant process in the federal government to address homelessness. It is the most interesting piece in social services that it is competitive for homeless funding. There is not a lot of other places where you are competitive for some of the most vulnerable funding, and it is a national competition. And so the funding that comes into the continuum of care, most of it is to renew and continue permanent housing programs. So a lot of not new funding.
Question for you. I basically understand what HMIS is, which we call, what's the shorthand name for it? Clarity, right? Yeah. But can you explain the difference between the coordinated entry system? I assume both of these are a database system.
So one is a practice, and HMIS is a data system. So a database, it's a relational database. Right. It has HIPAA compliance. Yeah. It is only accessed and utilized by any organization that's providing services. So administratively, I can't see it. But the coordinated entry system is a practice. It is a local practice by which homeless housing resources, people can access those resources. And HUD has required that you use a common assessment tool, that you are prioritizing how people are accessing their housing resources, and the state has added some to that. And through that, you have to have a transparent and understood process. Mm-hmm. So coordinated entry is a practice by which we use data a lot of times to support knowing information about the clients that are prioritized for housing. The way that it works within the data system, because it is sort of overlaid within our HMIS system, is that because you're looking at individuals, you're looking at individual records in prioritizing for housing. So coordinated entry as a practice, about 4 years ago, HUD now required us to count it as a program within HMIS, and that's where all of the client records primarily live. But it's important, it's a practice. It's not a separate database, but it is a way to prioritize.
I see.
And we prioritize based on the funding sources requirements to prioritize. So the continuum of care and RTFH, we don't set those standards. Those are actually set by the funding source for housing. They determine who's eligible, who we should refer to. And jump in anytime and ask
I
questions.
had a question in follow-up with that. CES is a practice or now a program of prioritizing housing. And the grant funding sets that. Are there alternative ways to prioritize housing within the grant requirements? Or is CES also, for RTFH, a way of optimizing your operations? Do you do any modifications to how you organize those individuals for housing beyond the requirements of a grant?
So that's a kind of a broad question, so I'll try and answer it, and please let me know if the answer needs a little bit more context. If the housing resource requires that all their referrals come through coordinated entry, right? So it starts with whatever is a housing resource. It has to follow in coordinated entry what is the way that we have used the tools to prioritize. Most of that is through sort of a scoring process. Now, those opportunities, those assessments are done by outreach workers, case managers who are working directly with that client. Those client records can be updated. That assessment, let's say someone's health conditions change, those can be updated. There are other housing resources that don't require going through the coordinated entry practice, and then the program that moves the data across. I'll give you a clear example, transitional housing. So transitional housing currently in HUD's requirements doesn't require that you use coordinated entry for people to be referred to transitional housing, partly because many of our transitional housing programs are specific to care and services, and are a lot of times clients are opting in for those, some of those being substance treatment, some of those being DV programs where we've got transitional housing, so it's a little different population. Coordinated entry from HUD to access their housing resources are for permanent housing resources. Transitional housing in HUD's world is not considered permanent housing. So there's, like, it depends on the housing resource. It depends on what the funding source requires. Also, let's say we have a client that doesn't consent for their information to be shared. They are not comfortable doing an assessment. Many of those folks sometimes, due to years of challenges, may not trust any of that space. They still can be considered for those housing resources. If we have a way to document that they're eligible for those, we can also prioritize them. So just want to be really clear, that is the bulk of what the referrals look like, but there are other opportunities in practice because people need to be able to opt out of having that information, but also be advocated for to be able to receive the housing as well.
Certainly, thank you for explaining that. So I understand there are some funding sources that have specific populations they intend to serve. And that could be HUD and permanent supportive housing. In which case, does HUD set the expectations for how people are categorized, or is that set by RTFH?
So RTFH doesn't set any of those, right? If we are categorizing where people are prioritized, it is either from HUD or another funding source that is actually paying for the housing. So
would we be able to get information on how HUD determines that prioritization for CES? Because my other thought is that some grants may say, we will only refer, right? Or you will only be able to complete this housing resource if you're referred through CES. But they don't have a specific, I would have to understand more about the grants, right? But from what you're describing, it sounds like some grants may say that in order to receive this resource, it has to be through CES, in which case RTFH is creating a standardization that the grants for housing or housing programs are able to use to justify providing that resource. Is that?
So I don't know if I would say it's to justify using that resource. Also, our prioritization tools are published, so we make those public. And they are not the same for families or youth or individuals. So they're prioritized a little bit differently depending on where you fall into those. There are some housing resources, like for veterans, that aren't required to go through coordinated entry, although we may have veterans in coordinated entry because they're eligible for multiple housing programs. So it's also important to recognize that there are multiple types of housing and housing programs that someone may actually be in coordinated entry and also being considered for other housing programs that are not required to go through coordinated entry. So it is and can be challenging and complex in a lot of ways.
It is complex. I'll probably
Yeah.
have more questions, that are not answered, but we'll continue to dialogue. Thank you for that.
Thank you.
I think we can move on to the next one.
So a little bit about the standards and trainings that we put out, just because it's one of our responsibilities. So also for the emergency solutions grants for jurisdictions in the county that receive those. So we have community standards, rapid rehousing standards, outreach standards, and age-friendly shelter guidelines. RTFH does a lot of training. There's a lot of frontline turnover in this industry, and we do a lot of training for that. Also under HMIS, to have access to the HMIS system, they sign a confidentiality agreement and go through training on how to collect that information and put that information in, and we do learning collaboratives as well. We oversee some fund administrations. The Homeless Youth Demonstration Grant, COC funds, are overseen by RTFH. We are the recipient of state funds, currently the HAP funds, which we're responsible to allocate. Also, the HAP funds are in the county and the city. And we coordinate and are required to coordinate how we allocate those. And then we oversee some philanthropic funds. As a nonprofit, we can fundraise, which is nice and beneficial. Most recently, we received the Bezos Family Day One Fund of over $5 million to address family homelessness. A little bit about the HMIS, when we talked about this, this is where the statute comes from. That requires HMIS. But what's interesting is most of the documentation that tells you how we're required to run HMIS come in what is known as HMIS notes. And that's where you find the privacy standards, the security. These came out in the 2004 Data and Technical Standards Notice. And then I'll also get you the information on the coordinated entry. I think I have a slide on it. One of the most important things that happened around HMIS when this was created was the privacy and security standards. HUD has been very strict and intentional about the information, the privacy of it, and how those standards, and it really was developed around the Health Insurance and Portability Accountability Act. Now, if you think about where we were in 2004, where we are today, in 2004, we were very much in a siloed space around data. Every department within the federal government and within counties and states, very siloed in their data. Where we're trying to get to today is more integrated data. But almost all of us are working from standards that were established back in the early 2000s.
That's some of my biggest questions for you today. I'm not an expert in the HIPAA law, but I've done quite a bit of reading that you can do by Googling and reading all the different sources.
Yeah.
And I'm sure it's a large law with thousands of pages, but it seems to cover healthcare providers. A healthcare provider that conducts electronic transactions, a health plan, a healthcare clearinghouse. The service providers are not healthcare providers. Some of them are, and certainly the protected health information, or PHI, as defined by the HIPAA law, is covered. And there's a big conversation about personally identifiable information. Frankly, we don't need it, and I don't want it. However, I feel that we've been deprived a sufficient level of data to really understand, and this is a real problem, and it's something that I'm ready to go to war over, because we're spending millions of dollars now, and we can't get real information about inputs and outputs in a system that we are accountable as a council for the oversight of many millions of dollars of taxpayer money. And it's unacceptable, and it will change. I'm going to make sure it changes. So how do we get that information? And, I've asked our attorneys, they don't understand the HIPAA law. I don't know who does understand the HIPAA law, but where do I go within the HIPAA law? Where's the CFR? Where's the, I'm a pretty smart guy. I don't see it in there. I'm sure it is because you're saying it is, but I don't see how the HIPAA law covers this stuff. And if it does cover it, great. How do we get non-identifiable information or anonymized information so that we can better understand the inputs and the outputs? We got this state audit out, on the local level. I feel the same way. So many millions of dollars spent and so little understanding about what the outcomes were for that public expenditure. And there's a narrative that, frankly, I believe, which says that the service provider community doesn't want the public and policymakers to understand what the outputs are, because who wants to be held accountable for the money that they manage? Honestly, nobody does, because nobody wants to answer questions. Don't ask me questions. I'm busy doing important work over here. I don't have time for your questions. Well, it's like when mom and dad give you money for sneakers and you come home without the sneakers and you go, don't ask me questions. I don't have time for questions. No, we gave you the money for the sneakers. We have a right to know why you don't have new sneakers on your feet. We have a right to know. So how do you, what's the answer to this?
Yeah.
It's so frustrating.
I also add that I'm of similar mind as you are, Mayor. I would definitely want to start the conversation with understanding and maybe providing information to our partners of what we would hope to accomplish with better data. I don't want to be prohibited in my knowledge as a decision maker, so I completely agree with you there. And it kind of reminds me of this tenant issue that we just talked about, right? If the staff can collect information about someone having, a social issue like a landlord-tenant conflict, right? And it's not any violation of HIPAA. If somebody's having a challenge with homelessness, why is it any different? I understand folks who are homeless have like higher acuity and can have medical issues, but I really want to seek as a council what we would like to do with data. So if you could, share your thoughts on that. And then, how is it different than any of the other services that we provide?
I have some thoughts about what the data would be useful for, but and I've said this in our conversations before, my assumptions are not looking for data to confirm them. I'm looking for data from which I can draw conclusions and information. Without the data, I have no idea. I'm flying without a map over here, and I have no idea what altitude we're at, what direction we're headed, whether or not we're getting there safely. All I know is that I'm being asked for more and more fuel, and never knowing whether or not we're getting any closer to the destination. And the only global information I have says we're getting a lot farther away. And the people who are burning the fuel are going, no, trust us. We just need more fuel. And it's like, no, I don't trust you anymore, because it's about money. And when it comes down to money, there's a lot of reasons not to trust people, because people have personal financial incentives. And I know that most people who are involved in the service provider universe are motivated by great personal interest in helping other people. But there are a few people who, are motivated by their own financial interests. We all are, which is why we have laws that limit the financial interests of elected officials, because as good intention as we are, it affects the way we think, right? It affects all of us. I mean, I'm saying something that's like completely obvious here, but we have no transparency in terms of where all the money's going, what the outcomes are, making sure it's apples to apples. And this is the new realm of homelessness. Is 7 years ago, nobody was focused on this. And homeless service providers, RTFH, everybody was operating in a dark, unlit portion, the dark side of the moon where nobody was paying attention. Now the problem has exploded and policymakers are going, that's not going to be okay anymore. We're going to shine the sunlight directly on that part of it. We want to know what's going on. There's demand for ever greater amounts of money. So I can't tell you what I would use the data for in total. I mean, the first and foremost thing I can tell you I want the data for is I want to know which programs are achieving a result of getting people off the street and getting them into permanent housing. I would like to know, if program A can house somebody for $30,000 a year and program B can do it for $15,000 a year, I'm defunding the $30,000 one and I'm going to invest more in the $15,000 one. Without the data, I have no idea what conclusions I could possibly draw. So the idea to begin with that the data would only underpin our existing assumptions is a bad assumption. That's not what we want the data for. We want it because we want to see, I ask the same questions of the fire department and every other department, what are you spending the money on? Exactly what is it? Let's get down into the paper clips. If you mind the pennies, the dollars take care of themselves. Okay, that's a lot of talking at you. What say you, Tamara?
Well, that's why I started with this slide.
Yeah.
I'm just going to share a little bit of my personal background because I think it's important. It sort of level sets and finds commonality in the work that we do. I did this work for almost 9 years for the state of Utah, one of the most fiscally conservative states in the nation. And I oversaw funding for social service programs, for homeless programs and housing. My primary role was to report out the accountability of the funding and our investments. From housing, homeless services, food pantries, our investments, and we used HMIS data to do that. I never had client-level data. We administered the HMIS system. That's why I start with the HIPAA. Even though homeless services, many of them are not healthcare providers, originally they were, because most of the housing was shelter plus care housing. It was for people with serious mental health issues. So most of it was healthcare. And then as we've contracted out, it has been cheaper to do it with nonprofits. And so county's not doing that work. They contract it to nonprofits. But originally, and I just want to frame why I have a HIPAA guidance around this. You also don't need to see client level data. You need to see program performance data. And that is a little different. Numbers that you've served, characteristics, trends of those, what are the services that you're paying for, all of that you want to be able to see. And I think it's important as you talk about it. That's why RTFH is not a direct service provider. We will never be, partly because that is not our role and it can blur the lines of what we do, right? And so the reason I started with this one was to tell you what underpins how the data is collected in the privacy of client records. We are actually one of the most transparent in data of the continuums of care across the nation, and I speak about it often. It took me a number of years to get the providers to trust us doing public-facing dashboards. Those dashboards you can get right down into program level. I'd love to come back and actually do some of those for you, but what I think is your ask is specific reporting for the city for your investments. Now, that's something we can do, and we've talked to your team about it. It starts with putting that language in your contracts, that they have to put all of their data in a timely manner, accounting for all of the services in HMIS, because if it's not there, you won't get a report that gives you that information.
If I
So
could
it's,
ask
sure.
Tamara, if it's possible for us to also get data, not just on the results of the funding from the City of Vista, but maybe the impact on our constituency, because I know that it is a sore spot for leaders in every single city to know that their investment is perhaps not going directly to their constituency. And you did describe, your jurisdiction as RTFH as being the entire county. And when I hear stories about folks in Vista being denied housing, permanent supportive housing options because they're being required to move to Chula Vista to get that resource, one, I want to know where the gaps in resources are locally, but I also want to know what's the genuine impact for the public that we serve. While I also understand that it's a regional issue, I don't know if I have ever seen any information like that.
Well, and I think the challenge is most of the housing resources are designed to be regional. Most of the cities don't have as much funding to say it's just specifically for our city, but you can do that. A lot of the funding that the county puts out is for the entire county. Housing authorities have very specific geographic responsibilities. So it's much easier in an area where I have a standing housing authority like Carlsbad because that hems in their geography for those resources. Where a number of your housing resources are probably county funded or state, the requirement is that it is available to everyone in the county. And so it really depends on what funds that resource and how we sort of lean in there. I think this is an important and critical conversation. And we just had this conversation in Carlsbad about some housing that they have that was funded by No Place Like Home. City of Carlsbad put funding into that. But the No Place Like Home funding required that the referrals were countywide. And even when we went back to the county and asked if we could do a prioritization for Carlsbad, the No Place Like Home funding is a countywide funding source, and so they required those. So there's spaces where we can get better and improve. One thing that we did in the last year—
Before we leave this data issue, I wanted to follow up on what you said. When talking about the need for personally identifiable information, I don't personally need the names of individuals or their PII or their PHI, but we do need what I call anonymized unique identifiers. The reason that we need those is I need to be able to look, not me personally, or maybe me personally, but our people that are putting statistics together for us, and frankly, I think the news media ought to have access to anonymized personal identifiers. Mark Twain said there's lies, damn lies, and statistics. Who puts the statistics together tells the story in the narrative and shape that they want. And I don't want you or RTFH or a service provider or any one entity to have a lock on how the statistics are devised. I guarantee you, if you put me in charge of the statistics, I'll make them tell you exactly what I want you to know. So I want university researchers. I want the Union Tribune. I want every news organization on earth, every academic, every personally interested person to be able to get enough information exported out of this system with anonymized unique identifier that they can't figure out who that relates to. And we don't need to know, we don't need to know their medical history in there. We probably do want to know whether or not they suffer with addiction, because I think that's a really important issue. There's information like that we could look at and we could start to analyze, and people could help us understand, and we can argue. Different people could have different analysis of the data, and we could come to different conclusions that could help shape this debate about how we invest money and whether or not we're getting our money's worth. But saying that, there's only be one organization that controls the granular level information such that only we get to shape the statistics, that's what's not going to be acceptable in the future. That's got to change. That absolutely has to change. There's no other way for there to be competing analysis of the data. So some people have to be trusted at least to have that anonymized unique identifier information as researchers or people that sign that, yes, there may be some way, if you give me a serialized anonymous number, maybe I can figure out who this is. Probably not. I think it would be very possible to sanitize that data so that people could understand it. People want to know how many veterans are homeless. They want to know how many veterans are homeless and addicted. They want to know how many homeless veterans have been in the system. They want to see all these data points. We don't have that level of granularity, not that I'm aware of. Maybe you do, but there's so much that could be known about this problem if only we could get granular access to information. And again, it could be with an anonymous, unique identifier, a serial number that doesn't relate to anything other than it's been, we're collecting these data sets Maybe it's based on coordinated entry. Maybe some of it, we go, that's PHI, that's not going to be exported. But there should be a whole data set that we can agree together. These are the data markers that we want to be able to export along with an anonymized unique identifier to the entire world of people. Maybe they have to apply. Maybe they have to prove they're a valid news journalism organization or an academic institution. But there should be some way that real researchers could get access to this information. My city homeless and housing managers should have the ability to export granular information. And these are professionals. They've given their life's work to do this work. They should be trusted on pledge and promise of secrecy to have access at least to an anonymous unique identifier. It doesn't make sense to keep it from them. Honestly, I think as a policymaker, we ought to be trusted with at least anonymized unique identifier, not PHI, not personal healthcare information, not personally identifiable information. But I think there's a lot more that could be exported that we could work with and interpret, and it would stop people like me from saying that other people are hiding the information about how the money's getting spent.
Thank you, Mayor. I would want to also see this information. I want to know what authority makes this information possible. And I want to give another example to illustrate what Mayor is saying. When we implemented our rental assistance program, I asked for our service provider to also include data, as they're collecting data on the clients that are being served, on which clients, or each client, it's being reported from those that are being served, who is on another form of income support or government assistance. Who are we providing rental assistance to? Who is also on food stamps, right? Or because there's this, we're serving a very low income community with this rental assistance program, are there perhaps people who are receiving rental assistance who aren't even on food stamps, right? So I want to have that information going forward. And I also wanted to ensure, can we get data on VISTA residents that are served by RTFH?
Sorry, didn't hear that. Can you get information
Can we get
on?
information on the VISTA residents that are served by RTFH?
So RTFH doesn't serve anyone, but we collect data for the providers. And I'll answer your question first and then go back to the anonymized data. We started 2 years ago to begin to think about how you could get specific data for cities, because HMIS, as it's required by HUD, organizes the data by providers. And so it doesn't necessarily organize it by geography. It wasn't really thought about as serving big geographies. If you think about San Diego County, it's almost the size of a state. And so really needing to know where people are experiencing homelessness was not actual location. Data was not collected. It was collected by where that service provider's primary location was. So if the city of Vista, as an example, had contracted with PATH, their primary location is downtown San Diego. And so it was a data set that in HMIS was not available. And so we started in October of this last year having everyone who collects information now to use GIS locations. So now we can determine where the people experiencing
And how long have
homelessness
you been
are at
collecting that
in
data?
October of this last year.
Okay.
So
because
we've been,
that's
so we've been,
identifying a big problem
Yeah.
because historically, some cities are not providing services.
Yeah.
The city of Vista, we're doing a really great job, but some cities are not. So if we're only collecting data on where services are being provided, you're going to have illustrations. And I agree with the mayor that if anyone has data, they're going to make it look like whatever it is they want it to look like, ourselves included. And if you look at some of these cities that are almost, they have this reputation, right, of being hubs for homelessness, but we're only really tracking the services that are provided there. So I'm very glad to know that we're also going to be receiving location information.
So we heard that loud and clear, and I think it is important, especially as more cities are investing their own resources really knowing, and also for some of it is to understand where people may be moving through the system as well, right? Different cities that they visit on a regular basis, sort of how does their journey look like?
So what information can we get about Vista residents that are entered into HMIS or who provide linkages to housing through CES? Because you're not a service provider,
Right.
but you have to have some record of Vista residents.
So what we can do is do some reports for you that will poll the individuals who are identified in Vista through that, what service providers are providing services, and what type of programs that people are utilizing. Because they may be utilizing 3 or 4 different programs as well.
And I think what the mayor is saying is we may want more information than that. We may also want information about those individuals in Vista who I don't, want to put them on blast, right? But I might want to know what the causes of their homelessness is. That would be really important to me as a decision maker.
Yeah. And I think the challenge is that's not always a question that's answered in HMIS. HMIS is, and I showed you when it was designed, right? It was actually not designed for the environment we experience today. It was literally designed to be the emergency room and collect information about that episode of homelessness. So it wasn't designed to collect causes of homelessness. It isn't looking upstream. It was really designed so that Health and Human Services should be really leaning into that and being more able to do prevention level work. HMIS and the homeless response system is really about that episode of homelessness. And so there's not a lot of places where causes of homelessness are actually collected in the data set. It is one of those questions we get often. The reason it was designed that way was it didn't matter why someone was experiencing homelessness when they hit the homeless emergency response system. It's how they're served in that system to then end their homelessness. Understanding that today we recognize how important it is to do better prevention work, to do better upstream. That's where causes are really critical and important. I understand the limitations of the data system that we're charged to oversee. But I think that that's also important, having done this work for a lot of years, wanting to get data out of the system that doesn't exist on the causal side of it, because that's not what it was created for. And I think it's an interesting space. And also understanding that
causes conversation.
Yeah,
right?
yeah, it's important.
Our mayor also had questions about other forms of data. Could you speak to that?
Well,
Yeah.
We need to speak some truth here, okay? When you're in a hole, step number 1, you want to get out of it. Step number 1 is stop digging. So everything should come to a stop, everything, until we understand better the causes. If what we're doing now is not capturing the causes and the drivers, and we have a huge conversation. I was in Sacramento on Tuesday, and they don't want to hear that addiction is a driver for chronic homelessness. The point in time count from a few years ago was presented. Sandag actually gave the numbers that were collected by point in time count, and they said that 5% of the people they counted and are suffering from chronic addiction, which is a ridiculous number. We all know it's 95% or more. So there's an unwillingness to be truthful about the data. There's an unwillingness to accept the fact that severe mental illness and substance abuse disorder drive chronic homelessness. We have this other population of homeless that are housing insecure, or they're not shelter resistant, so they're probably not chronically homeless. Anybody who says that the people that have been living outside for 12 months are not addicted and severely mentally ill is a liar. They're telling untruths. I can't understand why, but they are telling untruths. They are purposefully advancing false information. I think I know what the purposeful intent of it is, because they don't want to interrupt funding streams. But the people who are living in our drainage ditches and our waterways, these people are suffering from addiction disorder. And there's an unwillingness to confess that fact. It blows my mind. Like, I literally cannot compute why people can't admit that that's going on. We know it because when we wanted to clear the encampments out of Sycamore, and if our sheriff's captain was here, he would tell you, we simply arrested the people that were selling drugs into those encampments, and the encampments left on their own. They all packed up and left on their own because we targeted with narcotics investigation the people selling the narcotics into those encampments. And the encampments, poof, disappeared. We didn't even have to menace or harass the people in the encampments. We simply interrupted the flow of drugs into the encampments, and they left on their own. If that's not primary evidence that narcotic drug addiction is driving this problem, but we can't confess and admit that. It's some political thing with the majority in this state. I mean, I don't get it. I genuinely don't understand it. I wish somebody would explain it, but the purpose of refusal to admit that fact is so nefarious that the people that are behind it can't even explain why they won't admit the role that addiction plays in this problem. We can't get access to the information, so we can't tell the true story. You know, frankly, our news agencies and others need to be able to digest a lifetime history of somebody.
Mayor, if we could,
Again, not with their name.
I would like to hear from Tamara if we can get that information. I haven't heard definitively yes or no.
This is what we have. I mean, I don't know what else there is to be had, but this dashboard, and I like that this is good, but this is a one-page peek. You know, we need to be able to say, okay, you're a service provider. What service do you provide? Are you a housing provider? Are you a health provider? What is it you do? We need to be able to classify. We've spent a lot of time talking about terms. We had to create our own glossary of terms. I hope and assume that Mr. Lung reached out to RTFH and talked to you about this glossary that we've been building here. Are you familiar with the fact that we've built our own definition of homelessness terms?
I am not. That's not to say that he didn't speak to me. He probably spoke to Susan in
somebody
our
in your
office.
staff.
Yeah.
But the point is, there doesn't seem, I'm guessing RTFH doesn't have a glossary of terms. If they did, we would have simply adopted it, right? What's that? But is there a glossary that's maintained by RTFH? The point is, we kept having service providers come back with different terms, or sometimes the same term
Mayor,
that meant different things.
We have redirected staff to use specific terms in previous council
Well,
discussions.
but the point is, we just want the same terminology to mean the same thing. I don't care what words you use, as long as you tell me what words you're going to use and they mean the same thing every time. Because literally what was happening was the same term would come back and it would mean a different thing, or the same concept would come back with a new label. And then it became impossible to compare year over year because the labels were changing. So this is one thing I believe RTFH should do and could do for the entire county is, promulgate a glossary. You can use ours to start with or change it, or use it as a starting point. But in Lemon Grove and in San Diego and in Coronado, the same term should have the same finite meaning that it does in Vista, so that you can compare, so that the news media can compare and hold elected officials accountable, so that we can hold funders and service providers accountable. Obviously, if we're not all using the same definitions and terms to describe the same outcomes, inputs, and outputs, then there's no way to homogenize the data such that anybody could compare. The system doesn't want comparable data. Why? Because that would equal accountability. That would equal some people now benefiting from flow of money through the federal and state government. Those flows would be interrupted because their data wouldn't measure up. And so they resist it. They stand in the way of it. And I don't know, and I'd like to know more about how your board is governed, but I've looked through your COC board of directors, and the idea that these COC board of directors is promulgated, or the members are the people receiving the money through RTFH. I mean, how is this not the fox guarding the hen house?
Mayor, I'd like to give Tamara a chance to respond. And
Please.
if you could speak to your governing structure as well.
Yeah, the governance
Sorry, I know
structure.
I threw a lot at you.
No, you're
Big questions.
These are all really good questions because I believe there is absolutely a partnership and a path forward.
Yep.
And so the snapshot dashboard that you're looking at is one of the dashboards.
Mm-hmm.
You actually can drill into program level. We didn't have a lot of interest in it in a lot of years, and it takes a lot to put it together.
Yeah.
we can do custom reports. I'm just going to speak to the anonymized data and data marker. We do have a process that we work with researchers. We work with universities. We have a standard ask to be able to do that. Having done a lot of years of research as well, those are helpful in big data sets. They are not and are not best practice in smaller data sets. When you get down to a city size of Vista, we're not going to use those kind of anonymous because there is a good chance you can tease that back to an individual. So you use that data when you're doing bigger data sets. That being said, I truly believe there is a path forward. We create reports all the time. We did one for a lot of years for the Alliance for Regional Solutions. So we can do customized ones. We can do some custom things for you. Where we get challenges is things we just don't collect that people want to know that are not in HMIS. Also, I think to your point about the confusion of different terms, Health and Human Services funds it, DV funds it, the Department of Child Welfare funds it. We all use terms as if they're exactly the same, and they're not, right? Public safety does. So I hear you on the challenge of definitions. We do have standard definitions that we put out that are specific to HUD funding because that's our kind of lane. But work with us. Let's get to a place. Let's dig in. We can also, with your team, look at things that we can collect. We have a training database, so you're not looking at client level records where you can kind of see, here's some things we can create and things that we can do. Again, we're not a service provider. So I have no reason to do anything different with the data because my responsibility is to make sure that we're capturing as much of it as complete as we can for us to drive good outcomes. That's our job. And so I'm really excited actually to have the conversation because let's start with Vista, a city who is willing to do the hard work and also be willing to recognize that some of the things we just don't collect. And it's not because we're derelict in our duty. It's because I have a very specific and strict mandate from HUD of those kind of things, what an HMIS system is. It was meant to be a very small system in a bigger health and human services system. And so I want you to have the tools and the information that you need. I want us to be able to do it under practices and policies that I have to adhere to. We do have that a way that we work with researchers. We do with universities. We're in 3 different studies right now. We also only have so much bandwidth as well. And so I think to get to a place where you feel armed with adequate, appropriate information at a detail that gives you confidence that you can make those decisions and you can make comparisons, one funding source over another and really one applicant over another, that's what our collaborative application that we do with our federal funding is. We make those comparisons. We're happy to help your team and help you be able to do that.
If my professional program staff here at the City of Vista happen to be able to pair an anonymized unique identifier with somebody that they recognized and they were able to match that up, but this is a person who has signed on their professional credibility that they will protect that information. What's the problem with my hopeless manager having access to that information? Why is it that they can't?
Please let her.
Well, let me finish the question. When we first started hiring social workers, I thought that these were people that had professional credentials. What I discovered is, no, it's just anybody who comes. There's no credentials, no certifications, no educational requirements. I've got professional people here who've got a career on the line. When they make a promise, I want to know why that person can't be trusted. It doesn't make sense to me.
And I would say your team is trusted.
Why aren't they trusted to have access to this information by RTFH?
So again, it is a access to client level information. The practice and policy that HUD had set, and especially around HIPAA, is to get into client level record. It doesn't matter credentialed, you have to be actually delivering services to that client to be able to have that information. That's where the rub kind of comes. That's why we want to be able to give to your team as much information as necessary. You may have the credentials, but it may not be your job today to actually deliver those direct services. And so I absolutely hear you.
But we're paying for the services, and it is our job to oversee and conduct accountability and oversight for the expenditure. I want a really big level question. I searched Google for RTFH annual budget. I want to know how much money do you get from the federal government, how much from the state government, how much from the county, how much from private funders, and then I'd like to know how much of that money comes back to Vista. Is your budget, all your sources of revenue, is that, and all of your expenditures, is that available on the internet for anybody that wants to find it today?
You know, like a nonprofit, our 990s are available, but I'm happy to share a budget. It is, I don't know,
Why would that not be online for everybody who wants to see all of your, like City of Vista, every dollar we take in is, you can Google it right now, it comes up very, very easily. Every dollar that we expend is line itemized on a register that I have to sign off on every month, and we publish it. Every dollar in and every dollar out are all public. They're at your fingertips. The Union Tribune can access it right now, and they can write a nasty story if we spend money on something we shouldn't. Why is, where I assume that, what, roughly speaking, is 75%, 95% of your money is government money? What's the percentage of private money? Just roughly, ballpark. Is it more than 10%?
it is, well, we get multi-year funding sources, so I think that is
But it's not
a
more
little
than a
bit more
majority of your money. A
challenging.
majority of your money is government money, right?
The majority of our budget is federal and state.
Okay, so
Yeah.
the majority of your money is public dollars. The public has a right to know how their money's spent. Why does this organization not feel that having the transparency of expenditure of monies received and expenditures made on the internet is appropriate? This is part of holding policymakers who ultimately, we have federal policymakers, we have state policymakers, we have local policymakers that are involved with funding your agency. They are not being held accountable for the money that they have given you because they haven't demanded that your expenditures are online. And the other thing I'm curious about is, so how much of that money is coming back to Vista? Because we are, as you said, we are in your COC, but it is my perception, and it might be false, that we're getting basically nothing. That's my perception. Again, might be totally false. I have no idea. I would love to know how much of that money is being spent in Vista, surrounding Vista, how much of it came to La Posada. We had to pay $20,000 a year for each one of the beds that we leased from them. They didn't go, hey, RTFH is kicking in for Vista, so we'll give you access to shelter over here. If we wanted access as a city, we had to go pay them for it. Same thing with Interfaith. And this underpins a big question is, should I even be putting you through all these trials and tribulations to ask you all this? Or should I go, you know what, I'm not getting my fair share from RTFH, frankly, because City of San Diego is sucking all the resources because they have the big population and the political influence. And I should just go, hey, respectfully, we want out of your COC. We're going to form our own from Escondido to Oceanside. And we're going to tell you, you're no longer in our geography. Get out. Let us do it. We'll oversee and provide accountability as we see fit for the programs that we fund. Are we getting anything from RTFH financially other than participation in the point-in-time count?
So most of our funding is for housing. I don't believe that there is a housing program in Vista that gets COC funding. Although the state funding we have overseen, HEAP and HAP, there have been different types of providers in this area. We don't fund shelter. I think that's one of the big things. Continuums of care don't fund shelter. We do fund outreach. We did for a number of years, and it's partly what you apply for. Right now, we're in the process of putting together a 1.5 million grant that is a combination of townspeople, Vista, what's the other one? Level? Yeah. To be able to do shared housing work here. So it depends on what you apply for. The work from the continuum of care, things like HMIS, is funded for the entire county. That also benefits the collection of information. There's funding for coordinated entry. I think, Mayor, part of it is, are those programs in your community that the continuum of care can fund?
So you operate HMIS, and you've established CES, which is the policy that governs the entryway sort of into what goes into HMIS. And that's a service you provided that's part of homelessness. But what you're really saying is apart from that, I mean, this is what I'm hearing, correct me if I'm wrong. What you're saying is apart from that, we don't fund the homelessness service providers like shelters. We fund permanent housing.
Yeah, that is primarily what the federal government does with the HUD
What
funds.
percentage of your expenditures are permanent housing related versus emergency homeless? Because I'm almost thinking like, shouldn't you change the name of your agency or your organization from, Regional Task Force on Homelessness? It sounds like it should be Regional Task Force on Housing. Are you spending more money on housing than you are on emergency response to homelessness? It sounds like the answer is yes.
So HUD funding was primarily for housing. That is their outcome for homelessness. We, with state funding, have been able to fund more of the emergency level services like safe park lots, outreach. That was a huge investment from the state that allowed continuums of care to be able to fund in those areas.
So RTFH is providing money for safe parking?
Yes, we've provided funding for safe parking.
Can you give
We've
us money to
provided-
run our safe parking program that's here in our parking lot?
I don't know
Right
if
over
we are.
here?
We funded in Escondido. Did you guys apply for safe parking? Yeah, JFS is funded through us for your safe parking.
And did that defray, I'm looking at Mr. Lung here, did that defray the City of Vista's investment if they receive funding? Mr. Lung, I can't, the operative question here is, did an investment from RTFH defray the need for taxpayer money to support that program from the City of Vista?
Not that program in particular. So our RFP included $250,000 from the city of Vista. Jewish Family Service provided some kind of a matching contribution on their own accord. So the city still is paying its entire contribution as originally proposed.
Sorry, so to be clear though, the $250,000 that JFS put into it that was funded by RTFH reduced our obligation to pay the full amount.
In a sense, so a little bit more clarification probably is necessary. Our original RFP for safe parking included the city's contribution of $250,000 a year for its entire operating budget. We received two proposals. One came in for a $250,000 program. A second was from Jewish Family Service, which was a $500,000 a year program, which they offered to provide the other outstanding $250,000. So the city's contribution was originally $250,000, and it continues to be.
So you had one provider that was going to provide 25 safe parking spaces for $250,000, and another one that was going to do it for $500,000,
Correct.
but they got the other. So we went with the one that was going to charge us double.
No, the city's contribution remained at $250,000.
But they charged double. Their cost was double to provide the same parking space.
Not for the city. So they would.
No, their total cost. So they got the $250,000. I mean, this is precisely where a lack of communication. So we elected to go with a provider that spent double the amount of public dollars, even if they got half from RTFH, and it didn't increase our obligation. That's scandalous. What was wrong with the other provider that was charging half?
So the higher cost proposal, of course, included a lot of additional amenities and services, including the daily servicing of the restrooms, which you may remember, as well as
those were all
security.
things that were in our RFP. Those were all things that we required.
Not to the level that is being currently provided as contracted. It is a higher level of service now than the original RFP called for.
Because we amended it afterwards?
We just left it kind of broad to say that there should be restrooms, for example, provided on site. The level of services.
I know we're getting off topic here, but we're not in that, I'm trying to understand whether money from RTFH is coming back to Vista. If money coming back is only serving for us to buy gold-plated solutions that the taxpayers through the federal, the state.
Solutions, Mayor, I just really want to touch on this point because you were very adamant about the cleanliness of the restroom, and we did implement that after we found the contractor.
Yeah, but state contracting law requires that if we made substantial changes, we should have gone back out to RFP, and then we should have seen what the price was from, who was the bidder at $250,000?
Dreams for Change.
So Dreams for Change was, they should be back here with a lawsuit because it said, hey, you moved the target on us. We bid on A, but you wound up taking.
Maybe we should direct this to city attorney. One, is this conversation pertinent to the agenda item? And two,
It is pertinent.
is this a contract issue that the city should be concerned about?
I mean, it is pertinent in a general sense to the scope of questions in this presentation, but delving into the actual details and potentially alleging that.
Yeah, I'm not trying to go all the way down the rabbit hole here, but my point is, without access to information, we don't know. And I don't want to make sure that we didn't allow somebody to fleece the taxpayers for double the cost. And under state contracting laws, if we made substantive changes, then why did we not give Dreams for Change an opportunity to come back and go, well, no, we'll do that for $300,000 instead of $500,000. My point is, we need to be working together on this and really understand. It's a whole bigger conversation, but there's some smoke there. I'll come back later and look for the fire. Maybe not today. Maybe we can follow up on this. But it's really important. I just want to know, we're in your COC. You're counting our homeless. Correction, we are counting our homeless. The deputy mayor and I have both participated in the point-in-time count. Our staff has participated. We are showing up for a program that you run to count the homeless. You are receiving, RTFH is receiving dollars from federal and state government based on our homeless count because they're in your COC, that they're in our collective COC. So you're receiving money for our homeless, but what are we getting in return? I want to know if Vista is getting its fair share of state and federal resources from a continuum that we're a part of, that I know that we're not represented in any meaningful way in the decision making. And my concern is, and my fear is, that we're not getting our share of the pie. And my job as mayor of the city of Vista is to make sure that my people are getting theirs.
Absolutely. And I think we're asking similar questions, Mayor, right? Data on services provided, right? Which can equate to a cost to the city. And then also data on return from City of Vista resources that have been allocated to RTFH. I went to the restroom, so I went by this presentation, and did we do an overview of the publicly available data?
We did just a brief bit on that, what we have on the, let's go back. Oh, let's see. Oops, sorry. Does it allow me to go back? It doesn't want to. Oh, here we go.
It'll take us to the beginning here.
Your clicker doesn't love me. Am I pointing it at the wrong direction? Oh, thank you.
I wanted to know a little bit more information on the LSA Stella performance module. So is this evaluating the effectiveness of the services, or is this more of a technical review of how you're operating?
This is a wonky report. So Stella, the longitudinal system analysis, is done on HUD's 7 system performance measures. It is a very specific HUD, because it is a HUD database. It is looking at 7 system performance measures. And so that is its primary purpose. It is organized that way to look at lengths of stay, returns to homelessness, outcomes to homelessness, increase in benefit or income. They're very specific 7 performance measures, which is why Stella in and of itself is not utilized very often, because it isn't program specific. It's system driven performance measures.
Okay. And I just want to make sure that we're able to work together and get information on the data of the Vista residents that are served. And essentially what the mayor's asking is, what does our piece of the pie really look like in terms of return? And then my final thought on my end on the data question is, how do we as stakeholders provide feedback where you can deliver for us on those data points that we really want information on? Like I said before, I'm really glad that we're collecting location information now. how often do you update what data you're collecting, and how can you make modifications for cities like us that are in every good intention trying to serve the public, but needing to have robust information in order to do that? And you have described that the history of HMIS hasn't always fulfilled that brief, right? For cities that might need more information, or for organizations that are looking for better data. But you're not limited, right? Are you able to do more?
So HUD has data standards and identifiers of what we're required to collect. Those are usually updated every year. New data standards, things may change in gender, things may change in the age ranges. I think one of our real challenges is HMIS was created for a very specific role and a responsibility. It really was over federal funding. It's not a health and human services database. It's not a robust one to collect a lot of other information. One of the things that we did about 5 years ago is work with our providers and 211 CIE to have what's called a multi-party authorization, so we could share some of the data with CIE. And CIE has a much bigger data set because they also do a lot of the social supports. And so we've done work to kind of analyze what that data looks like. What I would suggest is let us start with what we have, what programs you have that are serving. Start with your own city programs. Are those contractors putting their information in? What are they collecting? What services? Let's just do a deep dive into what you're currently funding.
Do we
Is it
know,
in the system?
could I get information from staff, for example, for our rental assistance program? Is MAC entering into HMIS? I mean, the risk of homelessness for someone being challenged in paying their rent is something that we want to consider as an issue that I think RTFH could collect data on.
The VHAP program is not being entered into HMIS. It is a homelessness prevention program, but it is assisting those that aren't legally defined as at risk of homelessness by HUD, which is 14 days without intervention to losing their housing. So they could be housing insecure, but not quite at the level that requires HMIS.
So Tamara, in this situation, you wouldn't be able to collect data on those individuals?
No.
Okay.
Yeah, it's always sort of think of it as the emergency room. If you could get this at an Instacare, at a clinic, at your primary care physician, that data set, that information isn't in HMIS.
And then I see further in your presentation, you have more on CES. Could you just do a brief overview on the standardized language before we get to that? Because I'm sure we'll have more questions on CES.
Yeah, let's do. So we were asked if we could help you with standardized language, and I think that's what Jonathan's looking at. We have written standards for that data. We help with a lot of the crafting of contracts for various cities, for the county as well, and we have shared funding. So anywhere that we can help you with that, we're happy to do it. Partly because when you develop your contract language, it's also good to look at not only what you're funding, but what your intent is to measure, because it's very hard to back into it if not. So making sure that we can help with that language and then be able to make sure that then the setup of the program in HMIS, you're collecting all of that. So at the end of that contract time, you're getting the outcome data, because that's one of the hardest things, is at the end of the say a 1-year contract, and you think, we needed to know this. You didn't put it in the contract language. Right. It wasn't built into the data that's collected, the services, those kind of things. And then there's this concern of we can't see that. Yeah, because it wasn't asked for and collected. So really allowing us to help, and we have offered this to your team to help with sort of the standardized language. Our language is very standardized towards things that the county funds and our housing authorities, because they all use HUD funding. So happy to help with that and share the tools that we use as well.
Would you be able to provide us with that standardized language? Because we see gaps in our contract language all the time, right? Where I gave the example earlier of collecting information about income supports for people receiving rental assistance, right? I want to be able to see what the standardized language is and best practices are now, and maybe there's even more that we can add.
Yeah, and most of your standardized language is boilerplate contract language. Where you sort of struggle is in the scope of the work language is where most of it you'll have the challenges. So I think the definitions and kind of what that looks like, we can help you with that. All right.
I think we can move on to the next
Yeah.
slide. Great.
So coordinated entry, as we talked about, also in the Federal Code of Regulations, it is designed to identify the most vulnerable households and to connect prioritized vulnerable households to available community resources with as few barriers. That's the HUD language. How it happens in practice has really refined and evolved over time. So we're happy to share our prioritization and also kind of what those tools are so you can see them. A couple of things of what it is and what it isn't, right? It is a centralized system of identifying and assessing and prioritizing vulnerable populations. It is a match and referral process, but it isn't a guaranteed housing placement. So we do the assessment, refer them to the housing program, then they have to do all the eligibility, make sure that they meet the definitions and collect the documentation. What it's not is a guarantee for housing. It's not a wait list. It isn't a determination for housing eligibility. All of that has to happen at that program level. So this is a prioritization, a coordination, making referrals of the most vulnerable. That was the goal of it, to make sure that programs weren't cherry picking and taking the easiest to house, but that we were serving the most vulnerable with the most limited and sparse resources. And it's not a referral process for emergency shelter or transitional housing. So I just wanted you to have that as well.
So CES is only used for some sort of permanent housing, either through rapid rehousing, where someone is being linked to housing and being assisted with, rent to get into a stable housing opportunity, but it's not necessarily subsidized. And then also, quite significantly, as you're describing in your grants through HUD, through permanent supportive housing. So you don't link to other services through CES?
No.
Okay, only permanent housing.
Only permanent housing, rapid rehousing and permanent housing. Permanent supportive housing, and then there are state programs that they've required that, like the No Place Like a Home, where you have to have a serious mental health diagnosis. So, but it's only housing. Think of it as
Could you describe
permanent
that a little
housing.
bit more? The serious mental health diagnosis and the coordination you do for people in that situation?
So because the homeless management information system isn't a health system, we work with the county to identify folks that are also in HMIS, but also have that diagnosis of serious mental illness, or the SMI. They actually, we do some data match up, then they give us the prioritization of folks, because we don't have diagnosis, right, in HMIS. So it's a partnership with the county's Department of Behavioral Health to be able to identify their folks experiencing homelessness in the county who have the diagnosis of serious mental illness. Even our federally qualified health centers can't do the
And
diagnosis.
does that
Only the county does.
overrule any prioritization from RTFH? And folks that have serious mental illness go to the top of the list, so to speak?
So on their programs that are dedicated for someone that has serious mental illness, because look, an average case manager may not know that they have a diagnosis. It's the county who has those records, right? And so for the county resources that require that diagnosis of SMI, and No Place Like Home does, before we make any referrals, we're working with the county with a list of folks that are in HMIS. They verify that they are the SMI. Then we go back to all of the other prioritization and refer off the top of that list.
You might have a service provider that has client A, and client A is high vulnerability, high priority, but then does not have. I don't know if the scenario would even occur, but may not have encountered county health and human services and received a recorded diagnosis for their serious mental illness. And then the county has, client B, who is also high need, but has the record from the county. And so their placement is offered, right? Versus this person who doesn't have a record.
Yeah, I agree. I
So
mean,
making sure that people get into county health and human services and
critical.
are linked to that diagnosis protocol, so that there's a record in the county will allow them to get more resources. And then where are they placed? Is it permanent supportive housing, rapid rehousing? Because I know I've spoken with the mayor about this issue where we don't have enough housing for people who have serious mental illness.
Absolutely. I agree. Right? We know it's a limited resource. That is a county resource. There are a couple different funding sources. The full service partnership work where they can be providing the support, and that it's a sponsored based voucher that they can be housed somewhere, but you have to have that diagnosis. No Place Like Home is a county funding source that requires that. Some of the permanent supportive housing COC grants, when they were originally created, when it was a county and city COC, those require it. We don't determine that. That's not our role. That is a county role of deciding which of those resources.
And I understand the scope of RTFH and how the resources are administered countywide and prioritization occurs countywide and where the resources are and how that, is a problem, right? It's a problem for me in my city. And that's why I'm honored to serve, is because I believe that we need to be doing more. And as we're providing those services, we're prioritizing Vista residents, and we have the opportunity to do that. But with CSA, or CES, excuse me, with CES, are there any ways that the prioritization could be damaging? Or is there any room for us to advocate for changes to the prioritization? One of the things I consider is that a lot of times there are more resources available for women and children, but we have a really high population of single males who are experiencing homelessness. And with that question of, are there any drawbacks to prioritization, which I believe there are, I don't think it's a perfect system. What are the drawbacks that you acknowledge? And also, if there were to be a time frame put on this wait list, right? How, if we were to serve every single person within the system with rapid rehousing or permanent supportive housing or some other stable housing resource, everybody who's in the system with the services that we have now, what would that wait list time be? How long would it take for you to serve everyone?
I wouldn't know, partly because you would need such a abundance of housing resources, right? We have over, I think our last...
I have no idea.
Yeah. Honestly, if you had all of the resources and people had their documentation, you can house people quickly. You don't have the resources. So I think the challenge is the hypothetical, how quickly and how you'd be able to house them as quickly as you could get them leased up.
And by resources, you mean housing for people with serious mental illness, rapid rehousing resources, so rental assistance funding, even available units to, do we have available units to use that rapid rehousing funding? Like, do we have enough units in the county of San Diego to house people, but people just can't pay for them, and we don't have enough rapid rehousing dollars to get them into the units?
We have all of that, right? We have veterans with housing vouchers, VASH vouchers, who cannot find units or landlords to rent to them. We have folks who have been referred to rapid rehousing or struggling to find a landlord that will rent to them.
But isn't it California state law that requires landlords to not discriminate based on source of income, and subsidy is a source of income that is protected?
It's not necessarily they're discriminating against source of income. When they get 20 applications for a unit, right, it's supply and demand. We don't have enough units for all the people who are looking to rent. Homeless is a small subset of everybody out there looking to rent. We have the largest active duty military in the nation who are also competing for a rental, right? Like, it is a tough rental market for everybody. So rapid rehousing, what we hear is not a discrimination against the support. It's trying to find a unit where they're the top applicant for a landlord of 20 people applying for it. Okay. So the challenge is really just a housing stock issue, and that's true across California. It's not a San Diego. It's not a San Diego County specific issue. That's true. We have underbuilt and underdeveloped the housing stock we need, not just for people experiencing homelessness, for people on fixed incomes, for people on very low income.
Well, I had another question about permanent supportive housing, and I think rapid rehousing is different, right? It's assisting people with through the cost barriers of getting into a place after experiencing homelessness. And it's not housing and services, right? It's just assisting people getting into a unit. So that's, and I think that we could have a conversation about how effective that resource is in the long term, because with the high cost of living and, historically stagnant wages and challenges with people being able to afford rental increases, if it's not a subsidized unit and it's not a deed restricted unit that caps the rent in any kind of way, or if the person isn't able to manage their income to keep the unit, then rapid rehousing isn't the longest term solution available. But permanent supportive housing is. I've been a big advocate of PSH here on the council, and the city has 2 public parcels, right, owned by us that we are pursuing for permanent supportive housing. And we champion this because we know it's housing and services together that fully rehabilitate someone and allow them to, after living a traumatic experience on the street, reintegrate and come back into the community. But I'm concerned that this permanent supportive housing resource, this precious housing stock, right, that is so needed, because of the funding sources available to build this project, these projects, that we would not have any discretion over our constituency, our residents in the city of Vista, being able to have priority. So what is possible for the city of Vista? What can we do to ensure that we have local priority for something like permanent supportive housing here in Vista? Do we have to refuse certain funding sources? What should we do?
So I actually put it on the slide because I think it's important, because people will tell you it's a fair housing violation, and it's not. A preference for specific geographic boundaries or priority is not a fair housing violation. So local priorities can be established in the project contract. So when you're putting it together, let's say, and I don't mean to pick on No Place Like Home, but we've talked a lot about it. It's a state fund that comes through the county administers it. When you're putting that together, have the conversation with your developer, with your funding stack, that you want a preference or a priority, whichever they're willing to support, and get it in the language.
Well,
Like
this is my
that's-
priority, so thank you for affirming that we're able to utilize CES,
Yeah.
right, and prioritize
Yeah,
Vista
you just,
residents.
so much of this stuff is getting it in the contract, getting it in the language. What happens is that, people struggle to get the financial stack together, and then they'll take a funding source that supersedes everything that you were trying to do, that says it's a regional approach. And so it's literally having those conversations, have it with the county. What will most likely happen is, if you're able to get that, that'll be a first preference or priority, but not an only, because if they've got funding in it, I don't think this would happen, but let's say everybody in Vista who's experiencing homelessness has been offered a unit, and now you've got 3 that, no one in Vista, or we've ended your homelessness. They'll want you to make sure that to fill those with other eligible folks, right, that may be in a surrounding community. So it's really hard to get it
absolutely.
like down to only this, but put it in the preference and priority language.
Great, thank you for clarifying that.
You're welcome.
Back to you, Mayor, with questions on this part of the presentation.
No, I don't have anything else on this specifically.
Okay.
I mean, you asked some good questions, and I had the same questions, and that is, one of my biggest talking points lately is, we've got 774 subsidized housing units in Vista, and I think, what do we count, 88 people in the last point in time count? Is that right, Jonathan? So, yeah, I mean, if, we've got 10x the housing units, if we were triaging chronically homeless people into these units, we wouldn't have any people on the point in time count. But clearly we're not. We know from talking to the people that live in the subsidized housing units we built that there's a long waiting list. And we know that some of these people are definitionally homeless, and they're housing insecure, and they need help, but they're not in as critical needs situation as somebody who is maybe trying to exit a shelter. So the fact is, from the way I see it, those people who build subsidized housing would prefer to have people who are at 120% of AMI, who are more likely to pay their rent, pay a larger rent, less probably statistically likely to have calls for service from emergency services, less likely to damage the property, more likely to get along with their neighbors. So where is the housing stock for the people that are living on the street? And I always forget the name of what's the Carlsbad, starts with a W, the project that's gotten so much attention in the news. Well, Windsor Point. We don't want a Windsor Point here in Vista, but we do want to make sure that we're building housing units that will accommodate people who are leaving our new navigation center. As you know, I hope at some point you get a chance to go see our navigation center. It's one of the, I think it's, I've toured many shelters from downtown to Escondido to Carlsbad, and I think our shelter is the nicest in the county. It's very inviting. Everybody's got a semi-private room, and it's very welcoming. But we want people out of that shelter and into a permanent housing solution. And we're building all this subsidized housing product. And this is the big part that nobody wants to touch on also, is the housing we're building isn't accommodating the people who are living on the streets. It's accommodating some other group of people who are housing insecure, but they're not the people that are coming out of the shelters. I talked to a woman who said she was living with her son, and it wasn't an ideal circumstance. So now she has a one-bedroom apartment in Vista that's subsidized. She pays $450 a month for a brand new unit. And I'm glad that she has it, but if I was in charge with the magic wand, would I have put somebody who literally had no home to live in versus they were living in a room in their son's house? I might have preferred to give that room to somebody who had no room to live in versus one that wasn't ideal. This is the issue, is we're not triaging. We're not using our subsidized housing product for those who are in the greatest need first. In fact, we refuse wholesale to even have a discussion about it. And again, there's financial motives at play, but there's an endless call for more government subsidized housing. And I like to ask people, how much of the housing stock should we subsidize? Should it be 3%, 9%, 20%? Should it be 50%? And most people I've asked that question of can't give you a straight answer. And many of them won't even say, well, obviously it should be less than half, which it would seem that reasonable people would think probably somewhere less than half is the number that the other taxpayers need to subsidize. Because if half of all the housing units were subsidized, then presumably the other half of people are paying for that subsidy. So, where is the number? Why don't we have a target? That's a problem. But the bigger problem is that we can't even discuss triage. Nobody wants to talk about it.
Yeah, I would say the challenge that happens with housing stock like that, especially if you're using any of, and look, how does my authorizing organization? Housing authorities have massive wait lists because they don't prioritize based on need or vulnerability. They are where you showed up in the line, right? And that's one of those challenges.
That's horrible.
Yeah, that's why on coordinated entry, we try and do it by greatest need and vulnerability. Yeah. It's one of the few places within HUD that those of us in the work really lobbied with HUD, advocated with HUD to be able to have something where we could prioritize based on need, based on current challenges that they were experiencing. Most of these other housing resources are really just based on, I signed up for it, and I'm just waiting for my number to come up. It is where
Right.
you stand in the line, not who needs what.
The
So
other
I
thing-
absolutely agree.
I got an email last night from a senior at Rancho Buena Vista High School who is doing a policy piece. She's been assigned to, I've been getting several emails on different policy questions, but hers said, I noticed it costs $2,000 to rent an apartment in Vista. And she said, I'm just can't believe how expensive it is. And it's a problem. And I wrote back to her and I said, you know, I'm 45 years old. And for all but about 5 years of my life, I've had a roommate. When I first moved out from home, I had a roommate. When I went to college, I had a roommate. Today, I'm happily married to my roommate. But I've always had a roommate. And, you know, you started out with this idea that housing is a human right, but you don't have a right anywhere, not in the Constitution, not in state law, not in federal law, and certainly not in the law of common sense, to have your own place to live where you don't share with other people. I've shared nearly my entire life my housing with others. Why? Because it makes it much more affordable. In fact, one roommate has the effect of cutting one's rent in half. Two roommates reduces the rent by 66%. So these are obvious solutions that, again, we refuse to talk about. We need to do a better job of pairing people up to live together, because living together and sharing expenses, you know, it's very hard to go grocery shopping for one person, as any single person will tell you. You waste a lot of food. If you're preparing meals for larger groups, it becomes more efficient. There's all kinds of things in a household that make living cheaper when you have more than one person. So it is not an ideal circumstance to have people living alone. A lot of these individuals have behavioral and mental health challenges that do make it difficult, but many do not. When we're talking, and this is we're talking about this universe of substance abuse, severe mental illness, chronically homeless. And then we have this universe of people who are housing insecure. They're having affordability challenges, right? And we're so focused on the call to build more subsidized housing. And frankly, that subsidized housing can only ever benefit the people who are housing insecure and affordability challenged. It won't benefit, because if you're severely mentally ill and you're chronically homeless on the street, we'll just give you a place to live and pray that you'll go live in it. The problem is they won't stay in it. Instead, we find them back on the streets because they've gotten in a fight with their neighbor. They were evicted for something other than non-payment, because generally payment then is not the issue. We refuse to have a genuine conversation about solving these problems. I went to the convening that Nora Vargas did. There was another meeting, I forget where, the rescue mission has called us together. Donnie asked all the mayors to participate. 6 of us showed up out of 22 at the next meeting, and maybe 4 at the meeting after that. People really don't want to have this conversation. They don't care, obviously, and they refuse to get to the substance of the issues, which is really bothersome. And then our organizations, which are supposed to be leading the way, are not sounding the alarm. We can't just talk about the fact that we haven't built housing stock as if affordability is the only problem. I heard that at the Public Safety Committee. Senator Aisha Wahab from Oakland rejected a bill on Tuesday, where I was there to testify for it, which called to clear 500 feet from our schools because the kindergartners are being harassed by people defecating in front of the school building. And they refused outright to even hear that concept, and said, Aisha Wahab said that we should teach the kindergartners and the school kids that the streets aren't just for rich people, they're for the whole community. That was her direct quote. It's on the internet for everybody to see. In other words, they should just learn to live with people defecating, urinating, and exposing themselves and shouting vulgarities at the elementary school kids. Well, I don't think that they should. But because we cannot engage in a conversation about what types of housing get prioritized for what types of people, and voters are identifying this is the number one issue that they want solved because they see people on the street. So, and we can all kind of agree, I think, that the people living on the street are in the highest need to be sheltered, right? The people who, I like to say, when it rains, they're going to get wet, to distinguish them from everybody else who is in any way sheltered, whether it's in an emergency shelter or in some other kind of system, or they're living with their son or their brother or their aunt or uncle, whatever, and maybe that's not ideal. But when it rains, they're not going to get wet. So they have a roof over their head. I think we could all agree, and it's weird I have to get into this level of detail, but I do, because people on the other side oppose they won't even have this conversation. We need to talk about how to help the people that are unsheltered, that are exposed to the elements first. This is what our neighbors and voters are seeing with their eyes, and they're asking us to do something, and they're incredulous that we have not been able to make a dent. In fact, all of our efforts seem to have only multiplied the problem exponentially. And then when policymakers want to get to granularity, how the money's being spent, see the budget for RTFH, the dollars going in, the dollars going out. And, frankly, I'm sorry, if you're getting a federal dollar that goes to, and the federal government ought to demand this, but if federal dollars are going to RTFH, which is, I would call it like a quasi-public, because you're the big focal point, and we can't get out of it or, easily start our own COC. I don't know, and we're investigating that right now because I just don't feel we're getting a fair shake unless you can convince us otherwise. And then the money goes to this service provider or to a housing provider. We can't get the information. So the money goes in a black hole. Meanwhile, the problem gets worse and worse and worse on the streets, and there's a million pretended reasons. And I hear HIPAA guidance. I don't hear HIPAA statutory requirement. And my acute ear says guidance is not the same. And I look at the HIPAA law, and I do not see that you are covered by any of the categories of people who are covered by HIPAA. So I'm getting basically this legal unicorn is being thrown at me. HIPAA, shut up. Don't ask questions. HIPAA. I don't see where the HIPAA law, and I've asked, I've got lawyers here, I've got all the experts, I've read the law myself. I'm not seeing where HIPAA applies to any of this. So what I'm really hearing is, I don't want to answer your questions, and not from you personally, but I'm from the whole system. I'm hearing we don't want to answer questions, we don't want to be accountable, we don't want to put budgets online, we don't want to have apples to apples definitions, we don't want to have apples to apples outcomes so that our inputs can be measured against other people's inputs and outputs. We don't want any of that because we sit on the board of the organization that controls all the money, and we're deciding that we're not going to do that because why would we? It's not in our own self-interest. It's not in my self-interest to have to make, all the disclosures that are required, but I do it because it's required and because it's the right thing to do. And I would submit that RTFH should have their budget online, all the dollars in and all the dollars out, because it's the right thing to do. And people like me are going to ask questions and are going to begin to chip away at the public's trust in the system. And I believe for good reason, because if you don't put all the information on the table, then we think there's something being hidden. So just go ahead and dump the information on the table, let the chips fall where they may, and if there's a problem, then answer people's allegations. It's tough in government, and you're in government. You're taking massive amounts of public dollars, spending them. So I know you're a private organization, but you're still spending a majority of your dollars are government dollars. That makes you accountable just like me. At least it should. That's my call, is put it all online. Put everything online. Let people, because what we're doing is not working. Nobody can come and stand before me and say, the way we're spending money today, obviously making a great positive impact on the problem. It's not. I go to the Padres game, I hear people talk about San Diego, oh, it's so much better. I'm sorry, have you been to the Padres game lately? Because it doesn't look like it to me. It looks like Mad Max down there. People are wandering every street filled line with tents. It's worse than it's ever been before. We got 12,000 people in this county living on the streets. But the investment, we add the state, just the state expenditure for housing and homelessness for 180,000 people. We do the math on that, it's like $65,000 per person. $65,000 per person, just out of the state budget. That doesn't count what the city of Vista has spent, and that doesn't include the federal expenditures. So we're probably, in reality, we are well into six figures per homeless person as defined by the state of California and reported to the federal government. So more than $100,000 per person per year has failed to solve the problem. Clearly, we no longer have a money problem, and now we have a policy problem. And this is where getting to the information makes it so important, is because we want to get that money and we want to spend it to solve the problem, because like you said in your first slide, we too believe this problem is solvable, but not when people are going to hide behind a cloak of secrecy and refuse to lay the information on the table. Everybody's got to step up and be accountable, because helping these people get out of life and death on our streets is that important, that all of the protecting the fiefdom of the organizations, that's got to be set aside. And anybody who tries to protect their fiefdom, anybody who tries to hide from public review, they need to be pilloried. They need to be put on public display and said, this is not okay for you to hide with this secrecy when the majority of your dollars are government. You need to account for how those dollars, in fact, you know what? If you take $1 from the government, you need to disclose how you spent all of your money, because the dollar of government money meant you could spend the other money on other things. You know, water finds its level. So we need to know, we need total accountability in how you spent this money, because you could be hiding the ball from us. If you take government money, you should be public, period. I mean, it's just the way things have got to go. And I know right now, and you know, that I'm one of a minority of voices that are saying this, but I think that you can see the handwriting on the wall. It's coming. What I'm saying, I think you know is going to find purchase with the public. And it's going to be, I'm talking to everybody here, not just you personally, but this is important. This is the future of where this is going to go. Voters are not going to accept this lack of transparency any longer. It's going to have to change. That's what I'm fighting for.
Thank you, Mayor, for your comments. And I agree with the conversation about living with others and cohabitive living. I think it's great. You've always had roommates. I have roommates currently, and I think the benefit of the situation that you have is that home ownership and being able to, you know, own part of that asset, right, as a couple. And we want to encourage ownership.
I rented for longer than I've owned, though.
That's what, you know, which is gives you empathy, right? And it's just why I bring forward the discussion on tenants issues, because, you know, although there's not that ownership opportunity, is there a way that we can stabilize? Is there a way that we can establish something that's more of a cooperative environment? I even am inspired to research and collaborate with tribal communities who might be more familiar with sustainable use of housing resources. And I'm the type of person in my housing situation, I will make a big vat of something, right? And everybody will eat. And it just feels right it's very natural to live together. So some of the housing products that I think have been popular as we respond to homelessness aren't necessarily the perfect solution. And I've always been an advocate for alternative housing options. This makes me wonder, we didn't really get this in the presentation. You talked about one of your top responsibilities being planning. Tell us a little bit about planning for RTFH, and can you plan and help us to plan for different housing options, right? Not these kind of large, obstructive, high capacity units that are for an individual to have probably more of an abundance of space than they might even need. Are you able to help us plan for a variety of housing products, or what does your planning do?
Well, thank you. I actually was in DC presenting and shared the exact same story. I grew up in a large family. I didn't just share the place I lived, shared the bed that I slept in, right? I've always had a roommate. I happen to be married to mine, right? We're going on 35 years, so it seems to work. We've divided and conquered. But that's reality, right? And we've talked about that. I think we are, as a planning body, and it's also why we're funding $1.5 million of the state's funds to do a shared housing model with you all, right? We can't continue to house, we don't have the housing resources of one person, one unit. We're just, I speak to this often. we could reduce our numbers of folks experiencing homelessness, not the high vulnerability, high need, treatment, behavioral health, but the ones that never get prioritized. A lot of the single individuals that don't have the acute issues and are early in their homeless experience, that we should consider rapidly rehousing them in shared housing. It opens up a wealth of other unit sizes, right? We don't have enough 1 bedrooms. But if we were looking at 2 and 3 bedrooms, we were looking at homes that we can rent. Our housing stock to be used with the resources that we have are limited, not only in the quantity, but the actual types, right? Because most of our work is done in the 1 bedroom unit space. And anymore, it costs so much to build that 2 and 3 bedrooms are a little bit more cost effective when you're building. And that's why part of the developments of affordable housing are so expensive, because it's actually penciled out for 1 person, 1 unit. Super expensive. And so we've been advocating for this for 3-4 years, trying to get our homeless system providers to really think differently and think about rapid housing solutions where people share that and what the utilities will look like, and working with landlords in the apartment association to help us do those shared leases. A lot of our landlords are not interested, especially when someone's getting a little bit of financial assistance. Not a housing voucher, but a little bit of financial assistance. And so there's incredible opportunity there. I'd love to, because we're going to be funding you. So we're going to actually study this with you and really think about that.
And for the benefit of just public conversation about this, could you tell us more about the program that the city is being awarded a grant for?
Yeah, we actually had the city applied separately and a couple other ones, and I'm not over our grants, and so Jonathan, you might want to help me, along with a provider called Townspeople, that we've been putting resources in and really teaching and training folks on the front line. This was an ask that was made from different cities, and we said, for you to really get the benefit of the funding, we can't fund every single city for you to get the learning and the amount, but if you guys will do it collectively, we'll put this money into it. Do you want to talk a little bit about it, Jonathan?
Yeah, absolutely. Thank you. So just as Tamara said, the city did apply on its own for a home share program, for which the cities of La Mesa and Townspeople also applied for something very similar. So we were approached by RTFH to consider that collaborative application, which was just notified to have been awarded. So the exact program design is still under consideration, and we are actually going to discuss that with D3 of today's meeting.
And that's one of the things we're able to do that's a little different than if you're coming through, say, county or others. We're able to actually take those asks and say, you know what, let's look at these in a collaborative way and have that discussion to be able to put resources in a more transparent and collaborative way. Instead of everybody getting a little bit, actually working together gets greater returns. And I think it really could be transformational to the way that we think about ending people's homelessness if we think about roommates. Especially I have an aging population that are on fixed incomes. Having someone that may be a little bit younger who can also help with things around the house is a huge opportunity for us in San Diego to really think about housing as a thriving opportunity with multiple people. It's a different way to think about it and talk about it. We are, and do it often, because I think for us in California, it's how most people are making it happen. We need to do the same when we're thinking about
I
it.
appreciate you describing how you're planning for these innovations. I just want to state something publicly that when it comes to shared housing, I do have a caveat, and that is children cohabiting with adults, particularly adult males who they are not related to.
Yeah, we're not.
That does increase the risk and vulnerability of the child experiencing different types of abuse. So as the city is exploring shared housing options, families cohabiting together is already happening. Why do we see so many, parking issues on quiet residential streets? Families are doubling up. And we have multiple adults living in a property and multiple families living in a property that is really only meant to accommodate, a family of 4, a family of 6, right? So I do want to continue to be conscious of how children are impacted by overcrowding, and also how children can be impacted by the structures of shared housing, where they're living with adults that they are not related to. So I'm going to put that out there. But Mayor, I see you have some other comments. Thank you.
We spent $100,000 on a senior home share program. They took our $100,000 and they hired somebody to answer the phone. That's all they did. They set up a phone number and answered the phone. Nobody ever called because they never spent any of the money we gave them on marketing the program. They never said, hey, here's the phone number. You might want to call us. I don't know, maybe they sent a postcard once in the third year of the program after we told them, hey, you're not marketing this thing. I think we should be doing speed dating for roommates. You know, we should have regular events where we invite people to meet prospective roommates. We should give them subtenant, draft agreements. We should provide roommate mediation services, legal assistance services for roommates so that they can come up with an agreement, how we're going to share everything from the rent to the duties, who's going to take the trash out, how do you have a plan to successfully cohabitate? I had roommates, and I certainly had a few disagreements about dirty dishes. Usually it wasn't mine that were left in the sink. I didn't particularly care for that. I hope my former roommate's not listening. But these are things that have to be worked out, and the reasons people prefer not to have a roommate. But what if we were to advertise to people about the financial benefit and the emotional benefits of having somebody to cohabitate with? Maybe there's, and I agree with your point about men living with children that are not their own. That's certainly concerning. But two single men to cohabitate, or maybe it's two single mothers, that there's enough space for the children. I would probably think it's probably more single individuals that would benefit from it, but probably also we know that, and this is where I think the biggest growth opportunity in our program was targeted towards seniors, because we know that there's the biggest growth area in homelessness is with seniors. And so I still believe that, and seniors really, I think, would benefit more than anybody to have somebody to cohabitate with who's, also of the same age. But we need to advertise that idea. We need to make people feel safe about it by giving them, hey, we're going to have every 6 months, we're going to check in with you, see how things are going. We'll come by and visit, and we'll plan a family meeting or household meeting where we discuss, like, hey, is Dave, taking the trash out like he said he would? Dave, why aren't you doing that? Like, we could help facilitate for drastically less money than we can subsidize a housing unit, and literally cut people's rent in half. But we're not doing it because we've got this, it's a human right to have your own, one-bedroom apartment with granite countertops, kind of a mentality. That's a wrong mentality. Urban Street Angels, have you been there and seen their program?
Yeah.
They have a great, I would describe it as a college dormitory for transition age youth between 18 and 25, or 20, was it 24? 24, yeah. So, and I thought that's so great because, and it's 2 to a room that's like 8 by 12. And if you work the program and you earn your way, you can earn your way to having a private bedroom, but you get like an 8-foot by 10-foot private bedroom, then you share a gang restroom facility and they have a communal kitchen. That's great. We should have more of that kind of product for the young woman who wrote to me and said, I can't afford my own one-bedroom apartment. We should have a transition age youth program where, I would talk about, let's let somebody build an apartment building where it's for young people who want to live independently in sort of a dormitory style environment. These are great innovative ideas. I would have liked that. When I was able to afford to live by myself, I preferred it. But if I could have just had my own bedroom space that I could secure, I probably wouldn't have minded sharing a bathroom and a kitchen. And maybe we do that for seniors also. If affordability is the subject, maybe we can help people afford by giving them a secure space, and then we could focus more on the communal areas. But who's building that?
Yeah.
Nobody. Yeah. No one's building that. Why not? We know it would work, and there's nothing undignified about it. We lived in it happily in college.
I think that this is maybe even, city zoning questions. I know that I brought forward a discussion about minimum unit sizes, right? We can live in a smaller floor plan, right, than what we're used to. So I'm open to exploring. I think that that's great direction for our staff too, can we explore, in this discussion about resources that are are coordinated through RTFH, it's clear that there's a gap in certain products, and I would like the city of Vista to be able to explore those. I think those are great ideas.
I want to thank you again for being here. There's a lot of, and still with me, Regional Task Force on the Homelessness, your agency, your organization chose a big name. And it sounds like it's a lot bigger and more, than it is. And it makes it sound like your mission is bigger than what it is. I really think maybe you guys should think about a retitle there. If the majority of your dollars are for housing, maybe you want to be the Regional Task Force on Housing. But I want to see, I really do want to see your budget. And I really want to, if you can figure out, and I, ultimately, if it's federal and state money, that's a majority of your funding, then I'm going to go back to my assembly people and state senator and my congressman, and I'm going to say, I want to know of that federal money you're spending, how much of it came back to your constituents. And that is your problem now, because I'm going to go tell your constituents that it's not coming home to us. And I'm going to tell the congressman, you should stop sending it there until they start telling us where that money's going. And because I want it to be your concern as the COC manager to go, hey, we need to make sure that Vista is getting its, because if it isn't, then the mayor's going to get all hot and bothered and he's going to start telling people don't spend their federal tax dollars to RTFH. So I don't know what we're getting, but I'd like to see that. I think Escondido should know and Oceanside should know, and we should all know what are we getting back from this agency that controls, what's your total budget?
So our budget for the organization, right? Like we oversee federal and state, that is on the website. All of that's allocated out, right? There's 37 million. Urban Street Angels program you're talking about is funded through Continuum of Care funding.
great.
So we do have money in a lot of those. 37 million doesn't come through our budget, but we're responsible for coordinating
You
that.
oversee the $37 million annually.
Our budget is about 3.2. That covers your HMIS, all of the staff, the cost for the system, coordinated entry, and then our work of supporting planning and other things. And so I'll take that back to my board mayor.
And we're going on years having this conversation. If people are asking for this data, just because HUD doesn't demand that you put it in HMIS, why don't you do it voluntarily? Why doesn't your board prioritize that?
Prioritize.
Adding the information that you talked about is not in HMIS because HUD didn't require it.
Well, it's HUD's database. They set the standards and priorities for it. They give us the data
Did
standards
they
for it.
design the database?
Did they design?
Yeah,
they
did
actually
they actually write
determine
the
what
code?
vendors we can use for it. Like it's not a sort of
there's
homegrown.
So there's an
do.
off-the-shelf IT product database that basically you have to use their database vendor and it's their construct.
I have to use one of the. I think they're now down to 5 vendors that they require. Like it is really prescriptive. It is
So
not.
you can't add a category to collect information.
It depends on what the category is. It has to be somewhat. Let me work with your team. Let's see what we can design for you. Let us, Mayor and Deputy Mayor, if it's acceptable, I'd love to work with your team to really design some things to see if we can get to a place quickly with what you need. Also being able to report back what's actually in there and what is not that you maybe want to have in there as far as what programs.
But for the long
and then
run,
let us do that.
For the long run, I want the news media, I want the academics, I want the state auditor. I only have so much time. We're lay people, and this is I don't make enough money being the mayor of Vista to live in Vista, so I got to have another job that pays my family's expenses. So I don't have time to do all the granular level analysis, and I'm hoping that I have good people that will do that. But I need the news media, I need the academics, I need the other interested parties who are credible. I need them to have access to the data so that they can help perform those analyses that I can then consume as a policymaker. So having one source of analysis who says, no, I have it, and I'll tell me what you want, and I don't want that. I want transparency. I want full transparency as much as is possible. And I want people to be able to promise, because they're, like Mr. Bungie here, our housing director, this is a professional person with a government career, and I'm sure that it would be very consequential to him to want to keep his oath of secrecy to have access to this information if that was part of his job. I'm sure he would take that very seriously, as would Mr. Lung. You know, why could these people not be trusted? It's insane. They obviously can be trusted. We've placed great trust and confidence in them. Let them sign under penalty of punishment by law. We'll make it a misdemeanor crime for them to divulge the information. How is that not good enough? Every person who gets hired in with no credential and experience that works for any service provider who's represented on your board of directors can get access to this information, but we can't. And we're paying for some of the programs that are providing services to people that are in HMIS. We got to fix that.
Let me work with your team and let's bring
All right.
something back to you.
I appreciate
Thanks,
it.
Mayor.
Great.
Thank
Thank
you.
you.
Thank you for
City
being here. And
Manager.
I'm sorry to be so frustrated.
No,
I don't mean
look,
to be combative.
I've done this a long time. I believe we can get somewhere that's really helpful for you. And as we do that, that's good for my organization as well.
Good.
So
And I want to be a supporter of everybody else. And I want to
thank you.
I want to lock arms and raise hands. And I want us to all succeed together. I don't care who gets the credit as long as we solve the problem.
Thank you.
Wonderful. Thank
Thank
you,
you
Mayor.
for
Thank
having
you,
me this
Tamara, for
morning.
being here.
Thank
Really
you.
appreciate your presentation, working with us.
Thank you, guys. Appreciate
Thank
it.
you.
Wonderful. So we will move on to our next and final discussion. That's going to be on general homelessness updates. First, I'd like to ask staff to provide any updates they may have. Then Mayor Franklin and I will have the opportunity to discuss other activities related to the city's strategic plan to address homelessness. I don't have any kind of overarching topics for this. I think it's good that we continue to have this on the agenda, Mayor. I don't personally have anything. That's why I added the housing and tenants issue to the agenda earlier today. Would we anticipate any particular discussion?
I don't have anything specific, and I found out about 30 minutes ago that I have a family member that's been taken to the emergency room.
Oh, I'm
so
sorry to hear
I'm
that.
going to actually go get on a flight and go see my family.
Oh, I'm so sorry to hear
No,
that.
it's hopefully it's okay. But so any pertinent updates you have, otherwise,
Quick updates, Jonathan. Thank you.
Yeah, a couple of very quick updates. Next Friday, April 26th, will be the next City
bring
of
that
Vista
microphone right
Resources
up to your
Fair.
mouth. Bring that microphone right up
Next
there.
Resource Fair, April 26th, which is next Friday. That's going to be in conjunction with the Homeless Court at the Vista Village Transit Center. You'll remember last August we had something similar. We'll have that again. Also, the Humanity Showers outreach that was being done at Calvary Chapel will now be moving to All Saints across the street here from Eucalyptus every other Friday, 8 to 11.
Vista population, Encinitas population at BCNC.
Oh, yes. So currently,
I'm glad that you put it in size 4 font.
and it's
Did
also
you,
condensed
is there a
report
magnifying
too.
glass? That is literally size 4 font.
We'll get you an Excel sheet that you
exaggeration.
can manipulate as well.
Well,
but
what are
just
the
some
numbers?
quick highlights.
Yeah.
As of April 12th, there were 41 clients receiving services at the Navigation Center, 33 of which are from Vista, 8 pets on site. So far, up through April 12th, of course, for City of Vista residents, there have been 4 positive and 6 negative exits. 5 of the negative exits were self-exits, and the 1 additional negative exit was for violation of rules.
You said 33 presently there, so that means there's 3 of the Vista beds are available at this time.
As
as
of
of
April
this-
12th, yes.
as of
correct.
April 12th.
3 beds, correct. You got it.
And the Encinitas contingent, how many of their beds are full and how many are vacant?
Again, at the time of this report, that would make 8 from this. So that would be 4 beds.
Okay, 8 occupied, 4 vacant.
And how long have the Encinitas beds been vacant?
That I couldn't tell you on a quick update, but I can certainly look into that
If you
and
could
follow up.
follow up with me about
Of
that.
course.
There's probably a day-by-day change in these numbers, so it's more like a point-in-time number, right?
It is, yeah. And sometimes the referral process will take a little bit of time, and we also have to locate clients sometimes when they've been accepting of services, and then by the time they're ready to be transported, oftentimes we do have to find them because they've returned back into the community without phone or other amenities. But yeah, I can certainly follow up with the amount of time those beds have been vacant.
See, there'd be an interesting piece of information when we're out there on the street collecting information with our outreach workers. I'd like to know how many of the people that are living unsheltered in Vista have spent time in the BCNC, the Buena Creek Navigation Center. How many of them have spent time in another shelter? How many ins and outs are we having? Over the years, I'd like to know, are those ins and outs serving a purpose? Are we getting that person closer? You know, is there an average number of stays that, you know, that we have to achieve before we get them some help? I don't know. Again, the data, we don't know what story the data will tell us until we have the data to interpret.
Yeah, absolutely. I just note this was meant to be a very quick update. The next update, of course, we'll do a little bit of a more in-depth analysis of some of the data to be presented at the June workshop. We'll make sure all these are implemented with those reports.
You know, I would like for us to ask people who are exiting from the BCNC, I would like to invite them to come here and share their experience.
Sure, yeah.
On a totally voluntary issue. No, you know, there's no requirement whatsoever. But I would simply, if that's all right with the chair, extend that invitation to come and share with us their story. Absolutely no requirement to do so, but I want them to know that we would very much like to hear from them if they would like to share.
Yeah, we can make that
testimonies
offer,
and
absolutely.
Public comment is totally valuable to the discussion.
Just to clarify, would you like that for the next standing committee meeting or the June workshop?
I'd be happy to have them come to the standing committee meeting if they had an exit, favorable or unfavorable.
Well, I would say that's such a valuable testimony, and you know, if they come to tell their story, I would love for them to be heard by the whole council. So if they're able to come for
That'd
the
be fine, too.
workshop, I think that would be a little
Very
preferred
good.
for me.
I'm just saying, and that's fine with me, but I'm just saying on a rolling basis, I'd like to continue to hear from those people. I'd like to hear from, specifically, I'd really like to hear from the people that had a negative exit, if we can find them, okay? Because I'd like to know what didn't work.
Are we doing exit interviews or exit write-ups?
Surveys, yeah. So we're currently finalizing an exit survey draft.
Yeah.
That'll be circulated, of course, for approval. And then what we will do is we will have those clients fill that out and submit directly to the city rather than to the shelter operator.
Yes, please.
Yeah.
And I wouldn't mind having Hannah and Pete here to give us an update on
They
the
will be.
regular.
Oh, yeah.
We could have them, with the chair's permission, give an update at the beginning of the meeting. That way they don't necessarily have to stick around for 2 hours of us going on. But I'd like to hear from them what's going on over there, you know?
On a monthly basis?
Well, yeah, I think so. Until we get the idea that it's repetitive and no longer informative and a waste of their time. If it's a waste of their time, then nix it.
I mean, it might be, you know, receiving the same information from them as Jonathan is prepared for us now. But if there's different information or a perspective that they can supply of what they're experiencing at the shelter, then that would be great.
Sure, absolutely.
Yeah, anything that we can learn about this major investment that we're overseeing.
In fact, I would want you to work with them to collaborate on these updates.
Yeah. Perhaps I can give some statistical analysis and they'll provide some more anecdotal analysis, something like that.
That would be great. Yeah.
Very good.
Thank you, Chairwoman.
Is that all for your updates, Jonathan?
That's all for me. Thank you.
Okay, thank you. We're adjourned.